Okay, for tumors of the lung, I'll always start with the 8 important points. So the first point is definition. Of course, I'm not going to start with the simple definition of tumor, that it is abnormal growth of tissue which is growing uninhibited, but instead I will mention about the golden points here. So like for example, small cell carcinoma, if they have asked, I'll mention the most common uh, type of lung tumor that is going to cause paraneoplastic syndrome is the small cell carcinoma. And for if they ask squamous cell carcinoma or bronchogenic carcinoma, it is due to smoking, and central necrosis will be there most commonly. This is the typical feature of squamous cell carcinoma. In case of ACC, that is adenocarcinoma, this is the most common tumor which is going to cause early metastasis. That much you have to mention as a golden point for first point. Okay, coming to the second one is our classification. In Robbins they have given the histological classification, that you just remember this red highlight, that should be sufficient enough. That is squamous cell carcinoma, small cell carcinoma, adeno, large cell. I think if you remember at least 4 to 5 of them, that should be sufficient enough. Coming to the etiopathogenesis, so there can be either it can be due to genetic factors or it can be acquired factors. In genetic factors, you have to remember four important genes, that is TP53, retinoblastoma gene, and CRAS, and EGFR. You have to remember. So, in case of squamous cell, there will be inactivation of TP53 and RB. For small cell carcinoma, they are completely lost. And in case of adenocarcinoma, there will be CRAS mutation. And remember that in case of non-smokers, it will be EGFR that is going to get mutated along with TP53, while for chain smokers it is K, C, and here it is K, that is cross mutation that is going to occur. So you have to make some small memory tips that you can remember and summarize into a very short note. Okay, and then of course the third point is coming acquired causes. That is, acquired causes can be due to cigarette smoking. No need to remember all these parts, you just remember the headings here. And that is, cigarette smoking can cause it, or it can be due to industrial hazards. Like if you just mention in the bracket Hiroshima, Nagasaki, and asbestos exposure can cause it, that should be sufficient enough. No need to mention all these points. And coming to the third factor, that is air pollution can also give rise to your tumors of the lung. And then the fourth point is about the precursor lesions. What are the precursor lesions? Therefore, they are all basically the carcinoma in situ that are going to take place, which can cause this condition take occur. So this is about the first 3 points. Coming to morphology. In morphology, just remember 3 or 4 points, that should be sufficient, because this is not pathology paper, it is medicine paper. So for squamous cell carcinoma, there will be cauliflower-like growth with keratinization seen. In case of small cell carcinoma, there will be azopardy effect, and there will be salt and pepper pattern on histology. And remember that small cell carcinoma is a part of oat cell carcinoma, and adenocarcinoma shows mucinous pattern also. So it will be having a lipidic growth, and there will be glandular differentiation seen because of the mucin production over here. Got it, that should be sufficient for morphology. Coming to clinical features, now this is the most important part. See, all these features, all this whatever I have taught, this is not so important. The most important part is clinical features. Yet I remember all those points because it gives you a pattern. And remember that you don't think that for a 10 marker, if you remember 10 points, you will recall all those 10 points in the exam. My strategy would be to try to remember at least 25 to 30 points, so that at least you remember some 7 to 8 points in the exam and write it down. Okay, so that's the strategy that I adopt to prepare for the exam. Remember some 25 to 30 points, and expect or hope to remember at least some 20 to 30% of whatever you have read in the exam. Okay. So coming to clinical features, you have to remember about the pulmonary symptoms, that is cough will be there, breathlessness, all those things you have to remember. All these are very important. And then clinical signs you have to remember. Clinically, what you will be seeing on examination, there will be presence of decreased breath sound, dullness on percussion, mediastinal shift, all those things you have to remember. And then coming to extrapulmonary features, this can also be part of the complications also, that is extrapulmonary, that is due to spread of the tumor, very commonly seen in small cell carcinoma. So that is extrapulmonary features are basically the paraneoplastic syndrome, like it can give rise to ectopic ACTH, SIADH, hypercalcemia, carcinoid syndrome. It can give rise to all these features you have to mention for extrapulmonary features. Coming to radiological, this one investigation, radiological typical chest X-ray signs you have to look for. So like there will be raised hemidiaphragm will be present. There can be presence of pleural effusion. Clearly you can remember with this diagram. This is most important diagram. Okay, and the second thing that you can do is after X-ray you will go for CT, and CT in case of tumors will also do what is called as PET. Okay, and then the third most important point you have to remember is pleural aspiration. We do pleural, we take a pleural aspirate and biopsy, and will do that is needle biopsy under CT or US guidance. That is, if the tumor is very close to the periphery, you do with this one percutaneous biopsy. Coming to staging, TNM staging is the only thing that is there. In 40, you just have to remember this in this point, that is 3 to 7 centimeter. Less than 3 is T1, more than 7 is T3. And if it spreads to other parts, that is to mediastinum, adjacent parts like mediastinum, heart, or greater vessels, it is T4. And for N1 and N2, they are all ipsilateral, and N3 is contralateral. M1 is, of course, it is distant metastasis. So this is about investigations done. Okay, and then coming to seventh point, that is we have to treat the patient. So the first hope is to surgically resect whatever the small part that is involved if it is in the early stages. If it's not possible, then we are going to the second line of treatment, that is radiotherapy along with chemotherapy. Some chemotherapeutic drugs, you have to remember these. And then lastly, the complications. So complication, basically in any case, complication is nothing but it is spreading to the adjacent parts. So what are the adjacent parts here? Here it can be spreading to the great vessel, like it can spread to the superior vena cava and cause compression of it, or it can cause pericarditis or cardiac tamponade can cause. It can go about and result in blocking the lower cervical ganglia, resulting in Horner syndrome, or it can damage the ribs, resulting in rib destruction, or it can go downward, resulting in diaphragmatic paralysis. It can go upward, resulting in dysphagia or hoarseness. All these things, if you mention, I think that should be sufficient.